Welcome to The Explainer. Today, we're tackling one of medicine's most common procedures and its shocking failure rate.
Get this, up to half of all peripheral IVs fail. That's according to multiple studies. So let's dig in. And we're talking about a massive scale. 300 million of these are sold every single year in the US alone. So you put those two numbers together, you get what might be healthcare's most common and overlooked failure.
Okay, so what does an IV failure actually mean? Well, the costs are pretty staggering for everyone involved.
Just look at this. A successful IV is cheap, maybe $30, but one infection, that can skyrocket to $56,000.
In total, that adds up to about $2.3 billion, and that's just for treating infections in US ICUs.
But you know, it's not all about the money. For patients, it means more pain, more frustration, and delayed care.
So why is this happening? Why do these simple little tubes fail so often? It really boils down to three things. It's this complex dance, right? You've got the tech itself, the caregiver's skill, and the patient's own body. And this interaction leads to 5 main ways these catheters can, well, break. Each one is a different problem. This chart shows it all. Infiltration, basically leaking, is the #1 reason they fail. It's not even close. So whether it leaks, blocks, or just gets pulled out, the IV has to be replaced, starting a painful cycle again. This whole situation really makes you stop and think, doesn't it? Why is this something we just accept? The study's authors put it perfectly. We'd never accept this for our cars, our phones, or especially our flights. So that's the real question, right? Challenging that acceptance is the absolute first step to finding a better way.